What's going on? Damon Tate here with PT Biz and the PT Entrepreneur Podcast. And I'm back with my business partner, Yves Gege. And we're talking about some dilemmas today. All right. There's two dilemmas that we're going to talk about that we see in the profession in different forms. And I would say we have some relevant experience with this. We see this a lot with our own, our own clients, people that we're working with. And the first one is the 3-year clinical dilemma. So we'll talk about what that is. And the second one is the 5-year business owner dilemma. And I think this will apply to basically anybody that listens to this, because you're probably going to fall into one of these categories. But let's start out with this. Let's talk about the 3-year clinical dilemma, because not only have we seen this, not only have we experienced this, and maybe it's not exactly 3 years, but it's usually somewhere around there. But even talking to people in, the APTA, professors, they're seeing something very similar with people that are graduating over the last, let's call it decade, where 3 years into working at a clinic, a lot of physical therapists start to question whether they want to continue down the career path of being a physical therapist. And they start looking for other options, whether that be outside the profession, whether that be, their own business, whatever it might be. They are looking for something else. And I am not sure exactly what the solution is for it. But it's something that if you are, new to the profession, something to be aware of, because we're seeing this happen more and more and more. And I think a big driver of it is the lack of time freedom. I talked to somebody the other day that started her own clinic right about 3 years out. And she said the nail in the coffin for her was that she had to take PTO to go to the dentist. And she's like, I have such a restrictive schedule. And for her, she eventually want to have a family. She's like, what am I going to do? If we have kids and they get sick, and it is a really challenging thing on schedules like that. So what are your thoughts on that 3-year clinical dilemma, Yves?
Oh, this is a good one for me because I can trace back my dilemma. And it took me, just for context, 10 years of being a PT before I started a cash practice. But if I go back, I was in the school system probably as a PEDS therapist for about 3 years. Then I moved to a little more flexible schedule as a 1099, doing PEDS still about 3 years. Then, I ran and started and grew that insurance-based clinic. That was about 4-ish years, a little bit longer, right? And then I kind of went to full into the cash, and that's something I've stuck with for a long time. So when I look back at that, and from having a lot of conversations with PTs who are trying to start something or are in the clinical dilemma and kind of unsure, I think 3 years is about that mark where it's not new anymore. You feel relatively comfortable. You feel like you're good at your craft. And then you look around and you're like, this is what happened to me. I look at my boss and I'm like, wait a minute. I don't want to be that person. Like, that looks awful, And so it's like, that's my upward trajectory. Or maybe, I think in cases now, I'd never experienced with this, but there is no upward trajectory. Probably for a lot of PTs, are just like, I'm a PT1 and then I can be a PT2 and make a little more money, but I'm basically been doing the same thing forever. So I think it's one of those two things kind of happen. And that's what happened to me. And I'm like, man, I have to find a completely different path because I don't want to be that person for the next 10, 20 years. Like, that doesn't sound good. And that's kind of the only option.
Yeah. I saw something similar in the military. Just, it's just a big organization, right? Whether you wear a uniform or you wear khakis and a polo, like, it's still an organization that's big and has a lot of infrastructure and layers to it. So, when I saw what my bosses were doing and the amount of administrative meetings they had, and that they were treating patients, but they were managing mostly. Like, a big chunk of their time was managing. And I even got experience doing that, not intentionally. Just I had a boss at the first clinic I was assigned to that had a lot of complications with a pregnancy. So she ended up being, in the hospital, very early, like earlier than her due date. And so I ended up coming in as this clinic director, essentially, they call it a clinic chief role. And all of a sudden I had 20 employees, basically 20 people that reported to me from multiple clinics. I had 6 months into graduating, essentially. This is where I got, kind of just dropped in because of what happened. And and then so I'm in all these meetings, and then I have like clinical stuff, and then you're trying to hire and replace staff, or you're dealing with trying to get National Guard, clinicians in to cover because we had like three um, pregnancy leaves at the same time. Like three of our clinicians got pregnant like the exact same time, and we're all like out. And it was legitimately, I had to call in the National Guard to get a physical therapist to come in and cover. It was crazy. Yeah. So, but this is all within a year. Like within a year of me graduating, I had to do all this, and that was a real eye opener because I was like, crap, man. Like I know what that job looks like. And as you move up, it's very similar to like a clinic director in a bigger clinic. You end up there's mentorship, there's management of people, there's it is what it is. Like a lot of people that want to be these pure clinicians, I don't think that they want to go that route so much. But if they want to make more money, that's the route they go. Now, this is not unique to the clinical world. Like if you want to work in any sort of capacity in corporate America, the same thing can be said. Like they value management at a higher skill set. They do fulfillment. If you want to be a consultant, eventually you become a director or a manager. If you want to become a partner, that means you have to drive new business because they value those skills at a different in a different way. So, and this is where I think there is you have to accept the fact that value is assigned to the work that you do, and whether you like it or not, that's just the way the game is played. So, maybe people don't know that when they graduate, right? Maybe I didn't know that, and as you realize that like progression in your career might lead to work you don't really want to do as much, I think that is what gets really people very frustrated. And then, they're kind of stuck, right? They're like, okay, am I just going to see X number of patients per week for the next 30 years or whatever, right? Yeah, that's called a job, right? That's what people do. Like people have jobs and they do all kinds of stuff. And I'm not saying that is what I want to do. Obviously I did not, but for a lot of people, that is exactly what they do. That's exactly what they do. So, I mean, there's like, to me, I look at it and I'm almost like, this is just being an adult. Like we have to just do things that we don't want to do sometimes. We have to miss things sometimes. And if you don't want to do that, then you have to create the job that you want. And that's where people make the transition, right? But for a lot of people, they just settle into that and that's their day to day. And they can focus on being a great clinician and still see a lot of patients. But I think a lot of people find a lot of joy in that as long as they're not constantly thinking the grass is always greener somewhere else. And I think that's what really makes people very sad when they look at this almost like a jail they've created for themselves. But in actuality, like it's a very fulfilling job in many ways. So I think a lot of it is the lens in which you look at that position.
Yeah, and I do think there's plenty of people, like we're a little bit obviously in an echo chamber. We're, entrepreneurial, have multiple businesses, and we're surrounded by people like that. So there's
Yes.
definitely people out there who just want to be a good clinician. They like clocking in, they like clocking out. Like
Yes.
that's great. Like we need plenty of those people. If you're probably listening to this podcast, you're probably a little bit more than that, right? And so
100%.
yeah, so you want like for me, it was like I wanted to be challenged regularly. I liked different things, and I wanted the ability to grow. And if you don't have those things, it gets really really difficult. And now we're just layering on, just like you said, all these things that make things so much harder, like our debt to income ratio, not there. The amount of administrative and paperwork we need to do, not there. The kind of patients that we're seeing at some of these clinics, not there. Like the our bosses and the regulations that we're having to deal with, and like you said, the lack of PTO and flexibility. When your neighbor down the street, I still remember this exact day. I'm a PT. I even own the insurance-based clinic at this time, and I go to CrossFit in the morning. I go to work. I've got kids at this time. Right at 8:30, I can start a little bit later. I come home at 6, and I leave every day, and he's there, and I come home every day, and he's there, and I'm, like, working from home. I remember that moment vividly, and I was like, "I want that. I want that flexibility," And same thing, like, if I wanted anything to happen, I had to, ask for PTO or just, like, go to the dentist. There was, like, such a lack of flexibility, and that hasn't really changed, I think, in our profession a ton. You work for a hospital and you work for, the flexibilities there. So you kind of layer all those things on top of each other. It's like, yeah, like of course I'm gonna be frustrated and I'm gonna search something else, whether unfortunately it's a different profession, or I think fortunately more and more PTs are like, cool, I'm gonna go do this on my own. This sounds awesome.
Can you see the disrespect that my dog just showed
He's
behind
with
me?
me off. Unbelievable.
If you're watching this, my dog Sally just jumped up on my couch. She's not allowed to be up there in the middle of a podcast, and then she knows there's nothing I can do about it. So I'm gonna leave her there. She just power moved me. But I agree with you, man. The time flexibility thing I think is what drives most people. In fact, I was actually on another podcast earlier this week, and I think there's people that are heavily motivated by money, and there's people that are heavily motivated by time freedom. Um, and for most clinicians, you probably didn't get into the physical therapy profession because you thought you could make $1 million a year. Um, that's not really in the cards for us. So, and you really like the personal satisfaction of being able to help people. There's a lot to be said for that. In fact, for me, I just couldn't, like, if I think about, could I take a consulting job with like a big, consulting firm, make a ton of money, work on projects with companies that I just see no personal satisfaction working with? Like, I just couldn't do that. I just wouldn't. I wouldn't do it. I would get burnt out so fast, and I would have no energy to do that. So most clinicians are like that. They need personal satisfaction, a mission in order for them to get motivated to put effort into things. So time flexibility is the big factor. And for a lot of people, they're not asking for anything crazy. And I think if you're an employer, you can be sensitive to this as well to not make the same mistakes where you can create more time flexibility in the schedules of a provider because they're not asking to just work from home every day, which by the way, ain't all it's cracked up to be. Like just being at your home office all day and, being on Slack and responding to emails and, whatever else, like being on Zoom meetings, I would much rather be in the clinic with people or not necessarily all day there either. I think the variance of being able to have something where you can work in person and something remote is actually very beneficial for longevity in a career. And that is what people need to realize with these clinical schedules is you can engineer those kinds of things in. You need to be a little bit more creative with how you structure them, but you can build these weekly schedules that do not burn people out as much and create time freedom. But for a lot of us, that's not what we experience. So we end up starting our own business. And the ironic thing is, you actually have far less time freedom whenever you start a business, because then you go from like, yeah, you're there, your neighbor's home all day. Now you're gone even longer, and you do that for years and years and you pay yourself less, right? So you end up going and starting a business. So, what we see is around that 3-year mark is where a lot of clinicians that are going to start a business are going to actually pull the trigger on that because they've kind of had enough. They're at this crossroads. What are they going to do? And the paths that I see are they either change careers, like if they're really entrepreneurial, like, don't want to be in the clinic, can't accept the fact that that's sort of the career they signed up for. They change careers, they go into something else and can very successfully do so. Or they start their own clinic, right? So 3-year dilemma over. You've figured out what to do with that. If you're listening to this podcast, that's probably around when you made your decision. I was like 4.5 years to 5 years out whenever this, happened to me when we started our clinic. But now you start a business. So now we get into the 5-year dilemma, which is uh, we see a lot of burnout in business owners 5 years into starting. So maybe you can hit on that if you want to kind of talk about why you think that's such a big burnout timeframe.
Ooh, I think there's a lot of layers to that. If I could summarize it in one phrase, and I feel like the honeymoon is over, in
Yeah.
a way. Because it's exciting year one. I think the upward trajectory for the first 2 to 3 years is super exciting. You have some degree of time freedom. It's a lifestyle business at the beginning. It's very, very profitable. You're in there and you're doing things. And then you get to like year 4 and 5. And I think either two things happen. One is you just don't have the skill set to scale beyond yourself. Like you just don't have enough leads coming in, or you're just not good at marketing or sales. You kind of just get stuck, and that gets really frustrating. Like if you've been working for 5 years and it's just you in the clinic and you're seeing patients all day, that just gets really frustrating. Or you get to the point where you do try to just scale and you're like hiring an admin and you're hiring another PT and you just you're just not very good at it. Ultimately, you just you have a lot of turnover. You get to the point where your leadership skills just get super frustrating, and I think at that 5-year mark, if you haven't got to the point where you have scaled beyond yourself and kind of hit the sweet spot, which we really like, which is 10 to 15 hours of clinical care, and the other time is basically working on the business and marketing, which I think is 3 to 4 PTs and a clinic owner. Like, that seems to be a sweet spot. If you haven't got to that point, then you do get really frustrated because you're just still grinding, and you kind of look and you're like, oh my God, same thing. Is this going to be how it's going to be for the rest of my life? And you hit that crossroad again of like, this happens to everybody too. Like, if you're a business owner, I really want you to listen to this. Everybody has moments, if not multiple moments, where like, did I make the right decision? Should I shut my business down? Like, we have those moments all the time. So if you're doing that, I just want to normalize that for people. Like, I think you have those moments. And in my opinion, those are the times you kind of lean in and try a little bit harder. But I do think that crossroad comes at that 5-year mark, just like you said. And it gets really, really tough for people.
I have a friend that's sort of a serial entrepreneur, and he says, business is the most fun game in the world when it's going well, and the worst game to play when it's not going well. Like, he's like, it's brutal. If it's not going well, it's literally the worst thing ever. If it's going well, it's just like so fun. And I guess that's the funny dichotomy of it, where it's like, it wouldn't be so much fun if you knew it was going to work, right? Like, the excitement is part of that. Like, it's like when you go skydiving, part of the excitement is, what if the chute might not open, right? Like, "Ooh, I don't know." You jump out and play, and then like it likely does, but sometimes it doesn't, and that's what makes it more thrilling, right? So you have to have the likelihood of failure for it to be entertaining and enjoyable and challenging, but also um, it's what keeps lazy people out, right? So I actually I sent some of this stuff to one of our head coaches, and I wanted his feedback on too, what he saw with like around this timeline and why people are hanging it up if they get about this far into a business. And one of the things that he said, he had a couple of things that I think are pretty relevant that I completely agree with. So one of them is that you've been unable to implement. So you've done a bad job of systemizing your business. So when you get started, these are two very different skills. Starting something and then growing and managing something are completely separate. They're very different. And oftentimes, somebody that's really good at starting something is very bad at running something. So if they don't build the skills of understanding how to systemize and run their business and to be organized, even though they might struggle with that, or to hire people around them to help with that, then it sort of flounders because it's very reactive. You're always sort of like responding to things versus knowing that things are going to be like in place because of the systems that you have. That's a very stressful place to be. Imagine that now as an employee of that business. Very stressful place to be. In fact, I was funny this morning. I was rucking, so I have my apparently people in my neighborhood call it the mother ruckers group, and that's I'm going to own that. I'm leaning into that. So my mother ruckers group this morning, we had about 10 people out there, and I was chatting with a couple of them while we were walking, and one of them was telling me about a conversation he had with a clinic. That it was an employee of a clinic, and he asked him, "Why did you leave?" Because they were interviewing this person to potentially hire them. He's like, "Well, why did you leave this clinic?" And this person they were interviewing said, "Well, it was like very unstable. The owner would tell us that he thinks they're going out of business half the time, the other half the time he thinks they're growing and doesn't know." He's like, "So I didn't know if I'd have a job." And I that is not like abnormal, to be honest with you. I think that a lot of business owners are really bad at managing a business. Like, it's pretty common sense to not maybe say, "We might go out of business, guys." Like, I don't know if this is going to work. Like, you think your staff sticks around for that? Probably not. So poor systemization, being a bad leader, which that's a perfect example of. And you don't know you're a bad leader until you find out the hard way. Like, nobody thinks they're a bad leader And then all of a sudden, your staff leaves, like people don't want to work with you. They have bad things to say about your company whenever they leave. Um, and then you realize, oh crap, maybe I suck at this. So like being a bad leader is another one. And then also, I think partially this is personality based, but some people are just like socially awkward. And that is a very shitty thing to hear if that's you and you're hearing this and you're like, maybe I'm socially awkward. And that is why I'm having a hard time getting people to want to apply to work here, keeping people here, maintaining and building relationships with other business owners around me. And that can just be sort of your personality, upbringing, many things. But that is something that you can also change, improve, work on to where you can soften that a bit, and that can really tremendously help your business. But that is a very difficult thing to hear, and to then say, you know what, I should probably change some of these things, because if they're affecting you that much in your business, it's probably going to affect you significantly in your personal life as well. And that is another one that is a very, very hard one. And we see this time and time again with people in the mastermind. I can almost pick it out. Just be like, this person's going to crush it because of X, Y, and Z. This person's going to have a hard time. And it's because they're going to have a lot of work to do on themselves. And not everybody's willing to do that.
Yeah, you're right. Somebody comes in to one of our programs and they have a lot of difficulty communicating, making eye contact, being emotionally intelligent. It gets more challenging for them for
Yes.
sure. And the hard part is, I don't know how to crack this nut, honestly, but like the hard part is, it's also very difficult for those people to come to realization that they
Yeah.
don't have that skill set. It's like pretty easy to be like, all right, I suck at marketing. Cool, I'm gonna be better at this. I suck at sales. I should be better at this. Like I suck at building systems. I should be better at this. But that one is just a really hard one to kind of, because, a lot of people, it's like their personality. It's how they've been for a very long time. So, yeah, I think that is definitely a huge disadvantage for those people. And the other thing I want to highlight too, you said it so well, was the systems piece, right? Like that is essentially that first skill set people need to develop, right? Like, I think you got really lucky. Like it's not your skill set. You had a wife who came in and like that is her
100%.
1000% skill set,
Yeah.
ultimately. And I was the opposite. I was more of a systems guy, and not as good at marketing sales. So I had to kind of learn that thing. So it was harder for me to kind of get rolling, but it was much easier for me to scale because, I was able to build systems that kind of worked without me. So I do think that is probably the number one issue. You get traction, you can get to 10, 20K a month, but getting past that, there's no way to do that. We definitely get people who come in the mastermind. They're like, I've been here for 4 or 5 years. I average 10, 15, maybe it's 20K a month, but I cannot scale past myself. And I'm like, do you have a lead tracker? And they're like, what's that? Like, do you have any KPIs you can show me? What's a KPI?
Yeah.
Can you pull this data for me? What do you mean? Like, how many packages have you sold of the 10 visit package in the past 6 months? Or like, let me get back to you. Takes them a week to get back. So there's so much. So I do think that is like, if you feel stuck at that 5-year mark and it's just you, I think the first layer is systems. And then that second layer for sure is, which we can dig into more too, is the leadership piece. Because I do think PTs naturally, like you said, think they're a good leader because usually you're a decent communicator. You know what I mean? Like you can do one-on-one stuff, but it's different with employees. You can't talk to employee the way you would talk to a patient. So like it doesn't translate, I think, as much as people think it does. It's a completely different skill set. And I was talking to a mastermind member the other day, and uh, the learning curve was hard. I almost think you've gotta fail at it a couple times. Like you gotta know what you don't want. Like the admin and the PT, like you hardly ever do it right the first time. To be perfectly honest.
It's normal too, and I mean, you bring up a great point, man. Like, for a lot of people like myself that are more sort of like good at the forward facing sales marketing stuff, like getting stuff started is something we're typically pretty good at. But then the administrative operations side, the systemization of things, we really struggle with that. We don't see the value in it as much. We don't really know what to do with it. Our brain doesn't work that way. I mean, fortunately for me, my wife is like a perfect complement as far as like an integrator is concerned with somebody like myself that's more kind of, forward facing, can go out, get business, and can really like I'm not afraid to get turned down by people. Like I'm not afraid to go out in the community and like try to drum up business. And I just like that's a skill set that you need as well, because on the flip side, if you're more systems driven, you probably struggle getting started. And you can systemize the shit out of everything, but you have no clients. So like that is I think a harder place to be, honestly. And you have two choices, right? You can be like myself and you can like learn the skills to be a better business owner. That's what a lot of people do, which, and it's something that I've had to learn a lot about as well. And as soon as you're like, okay, I give in, I have to learn about this. It's just, it's very helpful, and it makes your life much easier. Or you can hire somebody or marry somebody, I guess, and then that person works with you in your business. Like that's not the case for everybody, but like hiring an integrator or finding somebody that's like a more systems driven person is great. But you can't hire somebody to build your systems. I think that's like the other thing to keep in mind. You can't just be like, hey, just come do this for me. And, and I see that as a huge mistake people make, because then if that person leaves, you're screwed. And not only that, you just gave away all this power of how you want to run your business, because you're too lazy to actually like figure it out yourself. And that's something that a lot of people have to learn the hard way. So the leadership side, to speak to that for a second, here's my take on that. I think people swing wildly one direction or the other. People are either just kind of abrasive, just kind of like difficult people. They don't realize the way they say things, their tonality, their body language, it just comes across like relatively aggressive almost. And they run people off because of the way they give feedback, and maybe it's the way they email people, and so, like they're very, very like short and direct, but not everybody prefers to be communicated to that way. In fact, most people do not like that. And on the flip side, I see people they just want to be everybody's friend. And that is, in my opinion, just as dangerous of a place to be, because it's kind of like being a parent. You know what I'm saying? Like, if you don't have kids, this may not actually make any sense to you. But if you have a dog, maybe it does. I'm not doing a good job of that because my dog just took advantage of me. But you need to set boundaries. You need to set consistent boundaries of what people need, what your standard is, and hold them to that standard, and do so in a way that is really about helping them succeed. And when there's erratic behavior, where they don't really know what to expect, that is actually very challenging for that employee, because they don't know if they're doing the right thing or the wrong thing, and you've either positively or negatively reinforced them in a way that's confusing to them. And if you just want to be their friend, and I see this with people, that like my kids go to school with, and their parents just want to be their fucking friend. They get like, dude, grow the fuck up. You had kids, be an adult, like hold your kid accountable, because your kid is turning into an asshole because you're letting them do that. Or your kid is just like, doesn't listen to adults or whatever. I see this shit and I'm just like, I know what the problem is. It's because you lack the standards that you have in place for your kid. Now, you can take the complete opposite extreme, like families that I grew up in, where it's very regimented, very structured. My parents were not my friend, not even close. And in a lot of ways, that's a generational thing. But because of that, they raise people that are independent. And if you're taking this from this parenting example to your own clinic, you have to have this gray area that you function in between friendly and also like lead them with standards that you uphold yourself. And you can't swing wildly one way or the other, because that's what drives people away. And that can be a very hard thing to do, because you may not have much experience with that. You're like, oh, well, you know what? Let's go grab a beer. We can talk about this. Like, sure, whatever. And then that person starts to take advantage of you. And then you swing back the other direction wildly. And all of a sudden now they're confused because you just are like friendly with them, more so than you probably should be. And it's sad, because a lot of times you hire people that you would love to be friends with, but you can't. And that sucks, but that's what you signed up for. So you need to have a beer and then leave and let them hang out with their coworkers, because that's how you build culture. They're with their friends. You're not one of their friends. You're their boss. You're in charge of it, and you can be friendly and want the best for them, but you can't get emotionally so deeply tied to them as a friend, because what if you have to let them go because it's the best thing to do for the business? You're in big trouble if that's the case.
Yeah, you said it, hit the nail on the head. Like, there are people that are very confrontational and people who want to avoid confrontation at all cost.
Yeah.
It is that dichotomy that you need to live in. I swung hard the other way where I don't like confrontation. I don't necessarily want to have uncomfortable conversations, and you can use the excuse I did of like, they're adults, they should manage themselves, you know, wrong, right? Like, you need to be able, just like you said, set the standard and then also enforce it and be consistent. I think that's also a big challenge, right? Because at this point, in my career trajectory, I'm having uncomfortable conversations all the time. Like, it's just like I have more uncomfortable conversations than I've ever had to have, with employees, with business partners, you know what I mean? Like, all that, it's just challenging. But I have noticed the more uncomfortable conversations I'm willing to have, typically the better the business does and better the employee does too, right? So, like, if I wait to tell somebody who's being a jerk to one of the employees and I just wait months to do that, it'll fester and it'll get worse as opposed to like just telling them immediately. And I don't have to be a
Yep.
jerk about it. I can do it in a kind way and just be like, hey, this is what's going on. You can't talk to people this way. This is what this looks like. I know that you're better than this. Like, just having a quick conversation like that, although really uncomfortable in the moment, almost afterwards, just I think like your kids, right? Like, they'll respect you more. They'll appreciate the standard and culture that you've set. You just got to get through that, at least for me, that initial conversation and that uncomfortableness. And then swinging on the other side, which I see plenty of mastermind members do, is just like, not softening up a little bit. Like, you don't have to go in there and come guns ablazing. Like, I think most PTs are typically very kind-hearted, need to be nurtured. Like, look at the kind of profession you're in, and if you're super abrasive, I just have not seen that work. Maybe in other cultures, like in other professions, but in ours, for sure not, right? Like, there's definitely more of a, I'm not gonna say hand holding, but a little bit more of a soft touch when it comes to leadership for most of the PTs out there.
And that's fine. I mean, because the personality fit of the people you're working with it's a better approach to do so. But where I think people can really improve here is to have their core values established, to for your team to know what your values are and to hold people to standards based on the values. So, if you have a core value of, punctuality, people's valuing people's time, and you have a staff member that continually shows up late for things, this is a perfect opportunity where you have to have a conversation with them and say, look, this is one of our values. This is why it's one of our values. And right now you're not upholding that. Like, you're wasting the time of these other people. And that's not something that we're about. And now we've addressed this, like, I want you to know that this is something that we find very important, and we expect people that are part of this team to do so, because when you show up late, you show everyone that you value your time more than them, or you don't value their time the way that you should. And in our company, that's very important. And now they know. And if they continue to do it, that becomes something that it has been addressed, and now it's a continual habit. And that might be somebody that doesn't actually match your core values for your company that you might have to, let go, or they leave. Because as you hold people accountable to what your standards are, they either fall in line with the standards, which are not like extreme, like asking somebody to show up on time is not extreme. It's just like common courtesy. But if somebody does that, this is just a common example. We see this a lot, right? It's just like, you got to address this, but they need to know why. Because if you're just like, dude, just show up on time. Okay, that's not enough. Like, it needs to tie to like, this is what we say is for our core values. This is why it's important. And this is why it's important to the people that we work with. Like, they're taking their time out of their day. Don't waste their time. Be punctual, and that might be, okay, we need to better organize your schedule. Here's how we got to make sure that you're, able to do administrative side of things you have to do for your patients. There's things that maybe we need to help you buffer and learn around there. That's fine. We can do that. Just want to make sure you understand why it's important to us, and be on the same page with people, and then positively enforce that, right? Like, this is something where when you see somebody making improvements, you can bring this up in a meeting, and be like, Brian is killing it. Brian, I just want to let you know you did a great job this week, on time with all your patients. So glad to see that, you're taking their this core value seriously. Thanks for all the hard work. And like, bring that up in public and address that. Like that is a really important thing to do, is validate people. But the mistake that I see a lot of people make is they just avoid those conversations completely because it is uncomfortable, and it's uncomfortable for everybody. Okay, but it gets more uncomfortable if you wait longer, and the more that you wait, the more it just turns into a bigger problem, and then you have more anxiety around it. Like imagine, like let's say, I don't know, you're doing something that kind of gave you some anxiety, something that was maybe, let's just talk about just jumping out of a plane. Okay, like we'll go back to the jump out of the plane example. Uh, let's say your friend is like, hey, I want to go skydiving, you want to go later today, and you're like, yeah, okay, sure, right? Like you only have half a day to stress about that. But if your friend's like, hey, in 2 months you want to go skydiving, they're like, okay, you have 2 months to think about that shit. Like that's a long time for something that might freak you out, right? And so just rip the band-aid off, like do it in a respectful way. The one thing I want to transition to with this too, from leadership, obviously is a huge problem where people run into not being able to maintain staff, not be able to not be able to like recruit people as well because of that. But one of the big problems I see, which is I guess runs hand in hand with this, is a lack of profitability. And when you go through a growth stage, and you brought this up earlier, so it's early stage profitability. It's just you might be making $20,000 a month gross revenue. You might be at 70-75% net margins, but you're doing a lot of work. You're the only one doing work, but you're able to actually net a decent amount of money compared to working for somebody else. You make the decision to grow past yourself, to create non-active revenue, to create a business that actually has value. To try, let me say it this way: to try to do that, because it's not a guarantee. It's a hard thing to do. You then take a step back on the net profitability because you're reinvesting in a space, you're reinvesting in people's salary, you're investing in improved tech stack, all these things that are going to be able to improve the business overall. And at the same time, you're lowering what you're making. So you're working harder, you're taking on more risk, and you're making less money. And for a lot of people, if they can't break through that stage and get to the point where they're at least, $50,000 a month in revenue, if not more, with good profit margins, they start to question whether it's the right move or not. And they're also doing everything, and they can't actually hire administrative folks that are operationally savvy and smart. They can help offset some of the work they need to do. So I think the financial constraints that people see, in my opinion at least, is what really drives people to want to they want to quit, right? They're just like, oh, this sucks. Like I'm working so hard, and they never hit the profitability numbers that they wanted to. And then they kind of failed at like actually growing a team, and that's a shitty thing to feel.
You're spot on. I think that's when it gets really, really hard again, right? Like the beginning stages, I think, are the hardest, right? Just to get the traction, do all the marketing and sales. You don't know what you're doing. That's really hard. And it's probably just as hard right at that spot because if you do it correctly, just like you said, you have an admin, you have a tech stack, you have one, maybe two PTs, and you have a standalone space. And you, as the owner, either need to drop your clinical schedule down, which is less revenue,
Yep.
or you need to create more time and sacrifice probably your health or your relationships for a little while. So, like, that's a lot. And it's so spot on because if you get stuck there, you can't sustain. Like you will, like that's probably the only other time we see businesses, not fail. Yeah. I mean, not a lot, but a few, right? Like they just get so burnt out. They just can't sustain that long term. And it's so difficult because yeah, and you're making no money. At least in the beginning, you're bringing home some money. You're not managing people too. So it is truly again the hardest spot. And it's just to echo it again, that key of systems and leadership, like that skill set is the only thing that'll get you to break through. And it feels really frustrating that stage if you can't, because losing a staff member is really, really hard. Sometimes those things are out of your control too, having a bad landlord. There's also like a lot of things that aren't in your control as much as before again, and it's just tough. Yeah, they just can't stay there forever. You have to be able to push through that. On the other side is the best, right? Like we see so many people flourish when they get to that 4PT standalone space or in it and they love it, right? There's ups and downs as always, but like that's I think the ideal spot to be in as a cash owner. Yeah, no, you're right, man. That's a really, really tough stage for lots of reasons.
Well, I think for a lot of people, what they really need to shoot for, if they're going to do that, and it's changed somewhat, right, because of the cost of things in particular. But for a lot of people that are going to grow past themselves, it should not be, hey, I just need to get to like one other provider and I'm good, two other providers. I don't think that's enough. I think you need to really try to get to the point where you're generating, um, $100,000 a month in your clinic. So when you look at the dynamics of this, so number one, there's safety in numbers in a lot of ways. If you just have one provider and they leave, and maybe they leave because they don't like working at your clinic, maybe they leave because their spouse gets a job and then somewhere else and they have to move. These things happen, right? Like there's going to be transitionary workforce changes that are going to happen no matter if you're the greatest company to work for ever. It's just naturally going to happen. And it's very frustrating for people, but they just have to accept the fact that that's the case with any business, not just a service-based business like this. So when you accept that and you just say, okay, here's the target. If I need to be at $100,000 a month in revenue and I need to back into, let's say I have clinicians that are generating $20,000 a month in gross revenue, just as a simple example, that means I need to have 5 clinicians, working there if I'm not, if I'm not the one that's seeing a bunch of patients, which you probably can't see too much at that point. So let's say you need to grow to 5. They need to all be, relatively busy. You need to have a good average visit rate. And then you need to do a good job of managing your overhead and not getting too bloated in terms of your fixed costs. If you can do that, you should be able to be somewhere in the net profit range of probably like 25%. Just as an example of what we see with providers, that's net profit. It's probably going to be closer to like 30, maybe even a little higher in terms of owner's discretionary income. Meaning you with net profit, you would remove your salary from that, like what you're paying yourself. But you would add that back because that's what you're taking home essentially, right? So when you're there and you're doing like $100,000 a month, then you're talking about somewhere between $25,000 and maybe $35,000 a month in income. Depending on how much you're reinvesting back in the business, it could go down from there. But that also, what that does is it gives you more resources to reinvest back in your team, in your culture, in your brand, in the compensation structure for your staff, the benefits, all these things that make it a more enjoyable place to work in. You need money for that. And my wife, she used to run nonprofits in like a military nonprofit called Operation Homefront. She started the Hawaii chapter and worked at the Texas chapter. And they had a saying in Operation Homefront, and it was no money, no mission. And it was because like a ridiculous amount of what got donated went to the mission. It was like 98, 97%. It's like, and because of that, it was like terrible salaries for everyone that worked there. It was basically like a slightly paid volunteer in this nonprofit, but did great work. But no money, no mission. And when you're in your business, you need to think of it the same way. Like you need money in order to create a company that provides fantastic work environment for your team, and you all can work together and end up in a really cool place if you are able to actually grow a profitable business, period. Right. So like that is the key, I think, for a lot of these folks is, and this leads to leadership, this leads to systems, it all comes back together. It's all the same thing. And it comes down to you becoming a better business owner, like period. And this is what I see as a huge mistake is people that are just clinically, they're good and they grow their clinical schedule themselves to where they're full because they're a good clinician and they're good with people, whatever. And then they try to scale past themselves. And then they get punched in the face with the reality that they don't have any systems. They're a bad leader and they don't understand the first thing about their business finances. And to make that mistake and realize kind of sucks. But if you can just understand that you didn't go to business school, don't take this the wrong way. I thought I'd be fine. I was not. Like I had to actually get punched in the face too to realize that I sucked at business. And then it's like, okay, cool. This is what I need to fix. And you lean into that the same way you leaned into trying to become a great clinician and apply your skill of learning and being diligent and work hard, and you gain that skill. And that's where you see the growth in the business. But normally, I think for a lot of people, that shift of understanding, I'm built this thing, but I don't know how to actually like run it. It's like you built a manual car, but you don't know how to drive stick. And so you can maybe get it moving, but it's not going to be very functional.
Yeah, I think a lot of people, because we're not naturally business owners, right? Like, I don't think many of us are. Maybe there are a few people who came into this and like wanted to own a clinic and they're super interested in it.
Yeah.
Fine. But most of us didn't. And what I almost want to emphasize to some of these people, maybe at the 5-year mark or whatever, or any stage of business really, is like the number one health metric is going to be profitability no
Yes.
matter what. So like, don't feel bad about profit. Like, I feel like there's some sort of stigma, like we have some money mindset issues in our profession, but like you should be very exceptionally profitable and don't feel bad about that. Like, it's actually, don't look at it. This is what I'm trying to get somebody to change the way they're thinking about it. Don't look at it as profitability is money going to my pocket. Look at profitability as like the measure of the health of the business, right? Like we measure the health of ourselves through blood work or measure the health of how we're doing with our patients through outcomes and things like that. Like that is the measure of your business. And if it's 5 or 10%, like that's not good. You know what I mean? Like we want to be at 20% or higher. And if we're not, we've got to do those things. Like that's the number one, like ultimately the number one macro metric is if your business is doing well or not. Like I can tell you within a few minutes. And there's different profitability, different stages, and there's nuances, but ultimately you want to be exceptionally profitable, and that, will allow you to pay your people more, grow if you want to, just gives you way more options. And I think that's so better. And if we want to, just want to go to rabbit hole a little bit, if we want to go back 1 degree or 1 tier back, and we look at the 5-year mark and how do I break through? What are those KPIs? I think you kind of said it, is price per visit. Like, is my average price per visit $200 or higher? And the other one, which I think is ultimately a good sign of leadership and people don't look at, is just utilization rate. Like,
Yeah.
are people seeing 85% or more on a consistent basis? And if not, then something is going on. Like, that's like the key leadership metric I look at. I ask that first before anything else. I'm like, how many available visits do your PTs have? Where have they been? Like, and it's usually I hear it's like, well, they can see up to 32, but they're stuck at 15 to 20. I'm like, well, let's that's the problem. Let's find, now we can reverse engineer that, which I won't go down that rabbit hole, but like, there's multiple things that we need to look at kind of beyond that metric. So I like those two metrics if you're kind of stuck.
You're right too. I mean, the utilization ratio is really important. To me, I think what I want to dig into even more with that is what percent of those visits are coming back to see your providers that are not new. So we would look at that as like what percent is recurring, because one of the things that is just so important in a business is the new revenue, the recurring revenue or reoccurring revenue. So, and there's a couple of reasons for that. One being it's more stable for the business owner. You can forecast and project better, versus sort of this eat what you kill model, which is just based off of new business only. And there's no sort of snowball effect on the back end. But the other thing too, you got to keep in mind from a longevity standpoint for a provider, and you just got to put yourself in their shoes. When you see somebody that is a recurring patient, so mentally so much easier. Like, and in a lot of ways, it kind of gives you a break from solving complex medical problems that are like more intense evals. And if you're just doing intense evals all the time, and this is basically what I did in the Army, we're just eval and re-eval machines. We don't get to work with people through a plan of care. We don't get to see people on a continuity basis. Like, we see somebody once every, I don't know, anywhere between 2 and 4 weeks, maybe 2 and 6 weeks, depending on the location that I've been in. So, you're basically building out this long plan of care, and then a PTA is taking them through that. And you're just doing the heavy lifts of the evals and the revals. So, and that's strenuous mentally. So if you can get somebody scheduled to where half their schedule is people that are cool, that they like working with, that they, enjoy helping solve, like, I guess, progressive health and wellness goals that are non-reactive, right? Like, you're not solving a problem, you're trying to work towards a goal and maybe not have a problem or work towards performance. That really decreases the mental lift for a provider, because, you know, I'm not seeing patients anymore, but it's not like I forgot what that feels like to see, 7 one-on-one visits a day. And if half of those are evals or like new patient case studies or like new patients that you're like heavily trying to solve a problem with, versus, man, if that's like a recurring person that is just, it's just like a mental break. And I think that actually lends itself to much longer times of periods of time where you keep staff around.
Yeah. Well said. Just thought of a great reel. But like, why is continuity and lifetime value so important? And basically, it's less stress on the owner and less stress on the clinician.
Yeah.
Ultimately, what's like one of the number one things that we work on? Because getting new patients is very difficult. Takes a lot, it's nuanced, there's multiple things, and typically it's much easier for a provider to really focus on a continuity program and keep people around long term, which will just significantly decrease the number of new patients. And then as well, just like you said, just like happier clinicians because you also get to develop relationships with those people. Like both me and you, as we started to grow and scale, our caseload was just continuity people, people we saw on a monthly basis or, pretty much regularly. And like those were awesome visits because you have a lot of rapport with those people. Yeah, typically you're not doing as much critical thinking. You really enjoy it. You kind of, and now I've got a lot more bandwidth for these other things. So yeah, I think that's huge, and if you don't have a continuity program, you should definitely start working towards one. We will
Totally.
go down that rabbit hole of like why that's important and let's just discharge people left and right. That's a whole nother maybe podcast. But yeah, I think that is it's a superpower for our business if you do it well.
Yeah, and we'll wrap it up here, but I will say when you look at continuity or we consider like recurring visits, people coming back in without necessarily, just having to focus on new patients. If there's anything that I could go back and tell myself like day one, of what to like don't overlook, like make sure like, hey, idiot, make sure you focus on this, right? Like that's exactly what I was walking in my little windowless room office and just be like, hey, dummy, you stop discharging people. Like this isn't the army. All right. Like you can see them more than 3 times and they like working with you. So give them a reason to stick around. And it took me a good solid year before I realized that. And even then I didn't even really put any effort into it. People just would come back on their own. And if I had done that, like the math on it, in the first 2 years, we saw something like 600 new patients, like a ton. I was getting tons of evals. This is just me. So let's call 600. And let's say I just could take a third of those people and have them stick around even once a month, right? On an ongoing basis. That means I have 200 visits that I have that are coming in a year, uh, ongoing, right? Just popping in. That's an insane amount of money every year, right? So like 200 people times $200 a month, like they're coming to see me once a month. That's $40,000 a month. That's $500,000 a year. That's two people's schedules that I left on the table because I didn't have any idea about what a continuity offer was, why recurring revenue was important, and honestly didn't have the money mindset to even have a conversation about somebody coming back and seeing me because I didn't know if there was value there. So that is a massive mistake, and I'm telling you, I say this all the time. I can't make this more like important to like listen the fuck up to what I'm saying. That those numbers are like they keep me awake at night thinking about like what I should have done and why it's so important for other clinicians to do this. And yet they still don't listen sometimes because I don't think they fully understand until you're in it and you're like, oh shit, that's what he's talking about.
Yeah, I think I would tell myself the same thing, but in a different way. The thing that I didn't understand, and I would say this exact thing, is like just because somebody isn't in pain doesn't mean you can't keep helping them.
Exactly.
That was a huge thing for me to overcome because I was like, cool, within normal limits. Okay, you're functional. See you later. Like even in a quote CrossFit gym performance-based practice, like it took me a long time to get to the point like, oh, okay, like I don't know if I didn't think people wanted it. I didn't know if I just didn't think I had the skill set. I don't know what it was, probably a combination of all those things. But as soon as I got kind of over that, man, like things opened up. So yeah, I would just scream that in my ear. It's like just because they're not in pain doesn't mean I can't help them. Like,
Yeah. It's a
please.
great point. But like you come from the insurance world. I came out of the military. Like if somebody didn't have pain, get out of here, dude. Like I have a 6-week wait list for somebody to get an eval with me. Like I just don't have the bandwidth for this. And it doesn't mean that it's not the right way to work with people. And it doesn't mean that's not how people want to be addressed. And I mean, if you really look at like the push towards lifestyle medicine, so many people are looking for things like this. And, it's a great place to fit that in. And it's a fantastic way to continue to learn about, how to work with the human body, right? And the human in general, because there's a lot of other factors there that you need to learn how to, coach and hold them accountable, and how to ask questions about what they want to actually achieve, and help game plan how they're going to do that. Like, there's so much we can do with people that leads to not getting hurt, not having issues. I mean, even myself, like, I used to wait until I was like jacked up before I would go to the clinic that I sold, right? And as part of the sale agreement, I can go there whenever I want for free, right? And I literally wait until something's wrong with me, like a fool. Just, and it's what most people think, right? And I know better. It's just, time busy, or time poor, and there's other things going on, and you don't really think about it. But like, to have somebody that you can go to on a regular basis to keep you healthy is such a valuable thing for so many people. And I think as a profession, that's not what we learn in school. That's absolutely not what we learn in school. It's not what you learn in a clinic that has insurance. That's the primary driver of the revenue. It's just they're not going to get reimbursed for it, right? So, but it doesn't mean that's not a valuable skill, and that's a really well said example. So, all right, let's summarize this. So, look, 3 years in clinically, you're getting burnt out because you look at what your bosses are doing and you're not sure if that's what you want to do. If that's what you're feeling, that's normal. If you do want to stay in a clinical environment, my advice is double down on being the best clinician you possibly can. And I think, there's, I don't know if the best term is nobility in this, but like, there's nobility in being world class at something. And you don't have to start your own business to do that. And in fact, I think too many people don't look at what they do as something that they should be trying to be the best in the world at. And that's, in my opinion, a big flaw in just, I guess, society with social media. We see so and so is jet setting off to another country, and whatever. People make themselves feel bad because they see other people doing things. But dude, if you're sitting in an office and you're helping people legitimately get out of debilitating injuries and back to what they do, that is fantastic. That is like incredible thing you're adding to the world. You should feel proud of that, and you should try to be as good as you possibly can be at that. So if you're not thinking about starting your own clinic and you feel like you're getting a little burnt out in the profession, double down on being fantastic at what you do for a living, and understand that you're adding a lot of value to other people's lives. If you're sitting there and you're just like, I need more of a challenge, I want more time flexibility, the business side of things is a great direction for a lot of people to go. Or maybe you change careers. But once you get started in business, again, you're going to hit this plateau. You're going to hit this sort of, I don't know, invisible wall where it's like, 5 years in roughly for a lot of people, and you're just eating shit every day for 5 years. Like, it's hard. And in order to get your business to a place where it doesn't feel like you've created a cage for yourself, you have to have systems, you have to be a good leader, and you have to have a profitable business. Step one, understand your finances. Step two, make sure that they're in good working order. Otherwise, you're never going to get out of the day-to-day of doing everything in the business, and you're never going to even make enough money to hire smart people or give your staff enough compensation to keep them around long-term to solve your staff churn problems, which are going to lead to you even getting more burnt out. So it all sort of feeds into itself. But those are the big areas that you need to focus on and address. And if you don't know how to do those things, that's okay. That's why we exist. That's why companies like PT Biz are around, because we didn't go to business school. We went to physical therapy school. But it doesn't mean that you can't learn how to, you need to learn how to be a good business owner in order to have a successful business.
Yeah, one thing that we didn't hit on as much, and even within our programs, we just harp on knowing your finances personally and business-wise. Yeah. And we still have so much trouble getting people to look at this. And I feel like that is just another key skill that it has to happen. Like, just understand where you're at, understand where you are right now, right? Just like you are with a patient. I need to understand. That's why I do an evaluation. I understand where they are and know if they're making progress. And so, do that for you and your business. Don't keep your head in the sand. Don't be like, it's just going to get better. I don't want to look at this. I don't have the time. I think that's just another key skill that a lot of people don't have, and a lot of times probably causes them to like not go get help, and
Yeah,
focus on the right things.
dude. And we'll end it on this. Here's an easy litmus test for you. if I asked you to send me your P&L, your profit and loss sheet right now, you know what? Let's make it even more simple. Send me your gross revenue for the first 4 months of the year. And if you can't do that in about 30 seconds, you do not have a very well-tracked business as far as your finances go. I'm not even talking about all the expenses that are coming out of it. I just want to know what you made. And I can tell you, half the people in our fucking mastermind couldn't do this right now, because if we ask for financials, it's like pulling teeth to get them to send these suckers in, because the discomfort of the fact that they're not tracking the right things. So if you're listening to this and you're in our mastermind, I'm talking to you, get your shit together, because that is a very, very simple step. And it's going to take a lot of stress away from your life if you have your finances together, right? And these are people that we work with. I can't even imagine people that we don't constantly, badger about getting their finances together. You just avoid it and you avoid it and you avoid it. Or it's like your personal finances. If you don't know what you spend on a monthly basis, and I can tell you in 2 seconds. I track this stuff every single month. I can tell you the percentage of money that we spend based on the percentage compared to the amount of money that we make. The ratio. I can tell you this for the last 3 years, because I track it every single month, and I sit down and I look at it on a literally a monthly basis, and I do a little meeting with myself, a little financial meeting, and I knock it all out, because it makes me feel so much less stressed out to know where I'm at on the personal side and on the business side. And if you're not doing those things, you're 100% right, dude. That is a habit anybody can learn. You just have to get over the discomfort of the starting. It sucks, because getting everything organized and you're like, oh my God, it makes me feel bad. But you can't stick your head in the sand with those things. You've got to know where your business is at. You got to know where you're at personally. Otherwise, how do you know if you're even tracking the right direction, if you're making progress, right? I mean, it sounds logical, but for a lot of people, they have such a hard time with that.
End it right there.
That's it. All right. Litmus test. Send me your revenue. That's it. All right, dude. Thanks for chatting. Hopefully y'all got something out of this. Whether you're at the clinical stage where, you're hitting that sort of 3-year dilemma, not sure what to do, or you start a business and you're closing in on, 5 years in and you feel trapped. These are the things that we see that really help you make the right decisions to kind of break out of those ruts. And hopefully, this helps you, with the next step of whatever you decide to do. So as always, thanks so much for listening and watching, and we'll catch you in the next one.